My name is Erica Reeder, and I am the Center of Hope Coordinator at Franciscan Lafayette. I have worked for Franciscan for almost 24 years. So Center of Hope's been a passion of mine, is being able to be a part of that patient's care, sometimes at the worst point of their life that they could possibly be in, and also being that person that helps them network kind of that out of what happens in the hospital, which is at times can be very hard for them. So being part of that journey, being part of that recovery, and then helping them at some point hopefully find justice. So in the Center of Hope, we service all types and kinds of patients, so to say, males, females, children, adult, adolescent, so a wide range. So meeting that person where they are, and then obviously realizing those needs, especially child abuse cases or child molestation cases, those things that unfortunately are very common to us. Which then are helping navigate through, that safe discharge plan. And then obviously our adult and adolescent population, they have a little bit of a different focus, but making sure we're meeting whatever age or situation that patient is put in, we are meeting their needs. So Indiana gives us 120 hours to collect evidence, so 5 days to collect evidence with vaginal penetration. If there's other types of penetration, these are sexual assault patients that we have different parameters for. So however, that patient, even if they've showered, eaten, drank, all of those things that Plus, it's also a misconception that they have to have money and they have to have insurance. So we're funded by the Indiana Criminal Justice Institute for those victims of violence, where they come in and compensation is not only for their medical forensic exam, but then allows for that compensation after their exam for things like antibiotics, mental health treatment. There's a huge amount of money that is there to help them for mental health treatment, which is a lot of times definitely a service that most of them, take, I don't say advantage of, because it's their, it's something that's offered to them. But I would say that is probably one of the things we hear, or we hear from law enforcement, like, hey, she doesn't want to come because she doesn't have insurance. So you do not have to have insurance to come. Patients still retain their rights after an assault. With that being said, evidence can still be collected if that patient has showered, if that patient has eaten, if that patient, we've heard stories of patients that have taken 3 and 4 showers because it's truly they're trying to wash that individual off of them before they can even step foot out of their home to come see us. We have collected acute evidence with our Indiana State kit and have still gotten hits of DNA on the body. So that is not, yes, as they are encouraged not to do it, to try to get the best evidence possible. But with that being said, they still have that right, and we still will collect that evidence. So after that 120 hours, so after that 5-day mark, if a patient still wants to come in after an assault, they are most welcomed. And with that being said, they'll get an entire medical forensic exam, get the forensic photography if needed, get STI testing, any other lab work, any other diagnostic testing such as x-rays, CAT scan, anything that's needed except the Indiana State kit. The kit will not be collected based on Indiana's guidelines outside, but they still will get every other part of the exam. Patients can also disclose years later. So we've worked with some survivors that it took them a really long time to come forward, and that's okay. Especially some of those that were maybe abused as a child and they wait to report as an adult, and they still get a complete medical forensic exam, and we help them on that recovery. So those exams that have been over months and years look differently, and truly the only part that looks different is collecting the evidence with the Indiana State kit. And a lot of times they look differently too with what type of referrals need made. So especially some of our adults that have come in ready to disclose an abuse that happened when they were a child. and then working with them, working with law enforcement. DCS still follows those cases, Department of Child Services, which is absolutely amazing. So it's one of the things that Indiana is blessed to have. I know a lot of other states do too. But so a lot of times it's working on that prolonged recovery, and then working to see what maybe physiological or psychological, what types of things that patient suffered long term, and how we can then help with the recovery of them. Coming forward and reporting is usually their first and foremost, their kind of breath of, that they can breathe that sigh of relief. And then we work with them on that journey to then, get back to a better health. Patients come in and are in the window and consent to an evidence collection, because not all patients want a kit done. So we have to it's one of those things that it's their right? And so they'll come in and they disclose they want a kit done, and they're within the time window, so that we explain to them that during this process there are steps that they can choose to say, I don't want that done. And with that, we're only swabbing those areas that they give us consent to swab. In the kit, they also have a place for us to collect clothing. So when patients come in and disclose if they've had the clothes on, or some choose to bring us their clothes, because like that incident where they've already maybe showered, we will collect all that clothing. It all goes to the state crime lab and gets tested with their kit. So in here it allows us for the clothing, and then we have all of our collection envelopes here that come with swabs. And while we're swabbing, we explain each step of the way. It's a 2-swab technique, and the first swab is a wet swab, the second swab is a dry swab. And then some say, hey, can I collect the swab? Like, I'm not ready for anyone to touch me right now. And we'll guide those patients through that collection if it is somewhere non-genitalia area. So 2 swabs are collected. Those swabs will then be placed in the envelope that corresponds to where we collected it on the body. And then those envelopes are sealed with a patient label and then our initial, so at any time that they know that exam or that swab is secure in that envelope. Once all of our envelopes are collected, once all of our areas are swabbed that the patients disclosed, we're not putting them through extra swabs that aren't needed. So if they disclose maybe just an oral penetration and have had nothing happened from the neck down, we're not forcing them to take their clothes off to swab areas just to check every box or, on the kit, so to say. This crime cam allows us to take injuries of, or should say, take photograph of injury that sometimes the naked eye cannot always see. So a lot of times patients will come in saying, hey, I was grabbed here or hit here. A bruise, a laceration, a scratch, things like that that the naked eye can see obviously is easy to document for visible injury. That being said, though, this camera allows us to see things past what that naked eye is going to see through some enhanced inverted filters that are on it. And a lot of times if there's not something there, we'll ask a patient to point, like we'll palpate, we'll touch during our exam and say, hey, and they'll say, oh, it really hurts there. Or, hey, when they were strangling me, I really felt like 2 hands were around my neck, but they don't see anything. We'll take a picture with this camera, and at times I've seen actual handprints and bruising. And a lot of times that truly makes a huge difference in these cases. As sad as it is to say, a stronger case, the more visible injury, the stronger the case is in prosecution's eyes. And the big screen allows us to share. So some patients want to see all part of their exam. And this big screen allows us, we can either turn it towards the patient or away from the patient. Some patients want to be involved in their exam from top to bottom, beginning to end, and other patients are absolutely not, just, hey, do what you need to do and get me out of here. So a lot of times we'll have patients, that screen will be turned because they want to see, they want to make sure their body's okay. And then especially on our kiddo population, so those little kids that we're trying to let play a part in their exam, and a lot of times them touching the screen, because it's a touch screen to take a picture if they're not using the camera, and they'll say, can I touch it? Is that where, and so we just, obviously each of those are different based on the child or based on the patient, but that screen does allow us for sharing of images. So this is our current Indiana State collection kit. It's a little, about the size of a shoebox. So when patients come in and they're within that window of evidence collection, which the state gives us that 120 hours, we will explain to them the process of collecting evidence. That being said, we start with that head to toe approach. Obviously not all patients though want all swabs done. Not all patients want all parts done. At no point should any part of my exam be hurt the patient or be painful. That's a question that's always asked. So a lot of times we'll give them one of the Q-tips to say, okay, just like you would clean your ears out, touch it, rub it on your skin. That is as hard as I have to rub. It does not have to be a vigorous rub. It does not have to be anything painful. DNA does not live under that kind of top layer of our skin when we're collecting it. So that is a question that a lot of patients ask. Once all the swabs are obtained, once all the clothing is obtained, we secure it back in this box. If it's large items of clothing, like we've happened before, they'll take lots of brown bags. And then once this kit is secured with evidence tape, dispatch from law enforcement is called, and they come pick the kit up, and we track it into the state tracking system and give a PIN number will be given once this kit is tracked into the state, and then those patients can track that kit and see when it's been tested, when it goes to the crime lab, and then the crime lab is then responsible for notifying the law enforcement working with the patient, if there was a hit on that kit. So they get to kind of play a part afterwards. However, those patients that don't report to law enforcement and choose to stay anonymous, the kit will sit for up to 365 days. So in the state of Indiana, they give them up to 1 year to report to have the kit tested. If after 1 year they don't want to report to law enforcement, which is still their right and still fine to do, that kit then is no longer able to be tested. So we do try to educate them on that. If you think in the next year you might change your mind, you do have that full year. But if not, just know that yes, maybe this kit a lot of times may be just for peace of mind, that they were okay because we visually looked at something, but just to know then that kit then is unfortunately destroyed at that point. And then our point and our role, I should say, in those survivors are then working outside of here to work on their mental health. We make sure that we navigate that, give them the appropriate resources if needed. We do follow-up care so they can come back. The state allows us compensation for up to 30 days after an assault to come back, whether it's for medical testing for sexually transmitted infections, pregnancy, anything that could possibly have happened from the assault. We work on a safe discharge plan. A lot of times, especially with our domestic violence survivors, we are finding somewhere for them to go, helping them navigate maybe getting out of a lease, getting a safe place to stay. So just, it's a wide variety of things, but it all starts with recovery. So you can find a Center of Hope location at franciscanhealth.org. But I always say just call. We're here to help, and a lot of times by just having that phone call when they thought maybe they couldn't come in, or they thought, nope, I'm not, that happened a week ago, if I go in they're going to just laugh at me. Truly, a lot of times those phone conversations have gotten victims and survivors into us and have gotten help that I don't think they would have normally gotten.